You know the feeling, right? You've been there, sitting in a doctor's office, just drowning in a sea of medical terms. Or maybe you're scrolling through a health article online that honestly just leaves you more confused than when you started. Well, today we're going to dig into a simple but really powerful idea. How we show health information is every bit as important as the information itself.
And that leads us right to this question. Just think about that for a second. It's not always about needing more data or more facts. Sometimes the real breakthrough is just finding a better, clearer way to see what's already there. This is the exact problem we're going to unpack. You know that feeling of being completely lost in a maze of medical jargon? That's not just you. It actually has a name. It's the challenge of health literacy. And it's something almost all of us experience, but it can have some really serious consequences. So let's be super clear here. Health literacy isn't about your vocabulary or knowing big words. It's about your ability to find the right information, to actually understand what it means, and then, this is the key part, to feel confident enough to use it to make decisions about your own health. It's all about turning information into action.
And the stakes, they could not be higher. Look, when that communication fails, people might not take their medication the right way, they can end up in the hospital more often, and at the end of the day, they can face much worse health outcomes. This is a problem with real human costs.
So, if big walls of text and confusing explanations are the problem, what's the solution? Well, it turns out our brains are kind of picky. They have a strong preference. Let's take a look at why a visual approach might just be the perfect prescription for all this confusion. This right here, this slide, gets to the absolute heart of it. There's some pretty basic neuroscience at play. Our brains are simply hardwired to process images at lightning speed. I mean, way, way faster than we can decode lines and lines of text. Visuals just cut through all the noise, making complicated ideas easier to get, and maybe most importantly, so much easier to remember later.
And this is not just some theory, you know? Think about where this is most useful. Trying to explain how a disease actually works in the body, or showing the steps for prevention, or maybe illustrating exactly how to take a medication, or mapping out changes to your daily routine. In every single one of these cases, a picture is truly worth 1,000 words of dense medical text.
Of course, not just any old picture is going to do the trick. Creating a really effective medical infographic is, well, it's both an art and a science. So let's peel back the layers and see what essential components separate a truly clear visual from one that just adds to the confusion.
It really comes down to 4 key things. First, you need one single clear goal. What is the one takeaway you want the person to have? Second, use simple everyday language. Ditch the jargon. Third, the information has to flow logically, almost like you're telling a story. And fourth, and this is a total non-negotiable, the data has to be accurate and backed by evidence. Trust is everything. I mean, check this out. This is a perfect example of that second point in action. The goal is to be understood, not to sound like a textbook. The simple act of swapping myocardial infarction for heart attack instantly breaks down a wall and invites real understanding. It's that simple. And that logical flow is so important for building a narrative. See, a great infographic doesn't just throw facts at you. It tells a story. You start with the problem, explain the cause, list the symptoms, offer prevention tips, and you always end with a clear, simple call to action. It guides a person from a state of confusion to one of empowerment. Okay, so this isn't some pie-in-the-sky idea for the future. This stuff is happening right now. Infographics are actively changing how we communicate across the entire healthcare world. Let's look at a few key places where they're making a big difference. First up, let's go right to the heart of healthcare, the doctor's office. So imagine you're in the clinic. Instead of just talking at you, your doctor uses a simple visual to walk you through a procedure, or to show you the correct way to use an inhaler, or to make sense of a really complicated pill schedule. It just makes sense, right? We are far more likely to remember what we see than what we only hear. All right, now let's zoom out a bit to the community level. This is where visuals become a cornerstone of public health. Think about a public health crisis, like a major disease outbreak. Clear, simple infographics are absolutely vital. They can quickly show how something spreads, share easy preventative steps we can all take, and this is so critical. They can fight misinformation, helping to reduce fear and build public trust right when we need it the most. And finally, we've got the digital world, which, let's be honest, is where most of us are looking for information these days anyway. On social media, a really well-designed infographic can be the one thing that actually makes you stop scrolling.
It lets health professionals reach huge audiences with information that's credible and easy to digest. It's an incredibly powerful tool to fight back against the tidal wave of online misinformation.
Now, as amazing as this tool is, it's not some magic cure-all, right? To really use it responsibly, we have to talk about the potential challenges and take a peek at where this whole thing is heading next. You see, with this power comes a lot of responsibility. There's a very fine line between simple and oversimplified. Creators have to be so careful not to misrepresent data, to use images that are culturally sensitive, and to make sure this information is accessible to everybody, including people with visual impairments. So where are we headed? Well, this is where it gets really exciting. We're moving towards things like interactive infographics, apps that give you personalized health education, and even AI tools that can tailor information to your specific needs. But the core ideas, they stay the same: simplify without distorting and inform without overwhelming. And that really brings us full circle to the ultimate takeaway here. This whole thing, it's not about making health brochures look a little bit prettier. It is a fundamental shift in how we communicate. It's about building a bridge from complicated medical knowledge to genuine patient understanding, giving people the power to take control of their own health. It's about transformation.